Hello, and welcome to Gale Blade News. In today's news, we're covering the situation to do with the coronavirus, and it's considered that testing sewage will be an easy win. A sewage-based coronavirus test could be an easy win that would pick up infection spikes up to 10 days earlier than with existing medical-based tests. Scientists led by UK's Centre for Ecology and Hydrology has said that they're working on standardising tests to count the amount of coronavirus in a wastewater sample. The earlier you find a signal, the earlier an intervention can happen, says lead researcher Dr. Andrew Singer. That means lives will be made much more livable in the current crisis. A network of scientists from universities including Newcastle, Bangor and Edinburgh had already teamed up with local water companies to collect samples of untreated sewage from treatment plants, the first stage in mapping the outbreak through the sewers. Early in the COVID-19 pandemic, research revealed that people infected with the virus shed viral material in their feces. That insight prompted an interest in sewage epidemiology. By sampling wastewater at different parts of the sewage network, we can gradually narrow an outbreak down to smaller geographical areas, enabling public health officials to quickly target interventions in those areas at greatest risk of spreading the infection, said Dr. Singer. Our network already has 6 labs that are capable of doing that work, so a national surveillance system could happen tomorrow. So while the researchers say they already have a reliable test that can show the presence or absence of the coronavirus, they are now working on a way to measure levels of infection regularly and reliably across the water treatment network. It's easy to say whether something's there or not with genetic fingerprinting, explained Newcastle University's Professor David Graham, who is involved in the development of that test. But for the sake of epidemiology, which is life and death impacts, we wanted to be more exact. Professor Graham and his colleagues have now developed a way to quantify the genetic material from the coronavirus. We can count how much virus is in a sample, he explained, and because each sample comes from a water treatment plant that serves a specific community, we can also tell you an approximate number of humans from which it came. He pointed out that it currently took 7 to 10 days to establish whether a person had the disease, but he said we can collect a sample of sewage and give you an exact number per person within the next day, and that's for the community. We can tell you whether someone in the community has it at least a week earlier. The researchers wanted to fine-tune and reproduce this test before it can be rolled out as part of a COVID-19 alert system. While many countries, including Spain, have started monitoring their wastewater, there have been some early problems. One result that suggested coronavirus was present in Barcelona in March 2019 may have been the result of laboratory contamination. There are problems to be solved in order to maximise the accuracy and value of a sewage-based surveillance system. The propensity of the virus to break up when it is in water, the effect on the result of other contaminants, and how many sampling points need to be included in a UK-wide network in order to build up a useful picture of the outbreak. It seems obvious that we need to be doing this, said Dr. Singer, but it's an approach that's never been considered for an active outbreak. So what do you guys think of this situation? Do you think that this will make any difference to how we track the virus and where we can kind of locate it to? Can we do the same as kind of what we're doing at the moment, which is blocking off certain parts of the country if those are seen to have higher proportions of virus in their wastewater? Whatever you think, leave your comments down below, like the video, and don't forget to subscribe.